Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. We are discussing CT examination of a female patient who is 50 years old and presented with multiple episodes of ischemic insults. Here we have plain CT examination of the brain, which shows scattered low density areas in the distribution of anterior cerebral arteries on either side in supratentorial compartment. Here we have her CT angio. We can see that there is severe luminal nerving of both anterior cerebral arteries, which are barely visible, and we can see multiple collaterals are noted along the course of both anterior cerebral arteries on either side with a small aneurysm. Overall caliber of remaining vessels at the circle of Willis are relatively reduced as compared to the normal caliber usually noted in other angio cases of the brain. And here we see that right vertebral artery is not visualized. In such cases, our differential should be between vasculitis of non-specific etiology versus connective tissue diseases like SLE, while similar changes can be noted in the cases of moyamoya disease, where puff of smoke pattern because of multiple small collaterals are noted along anterior middle cerebral arteries, including the areas of thalamostriate vessels. In these cases, there is basically intimal thickening with fibrous tissue and abnormalities of internal lamina elastica with variable lipid deposit and virtually absence of the inflammatory reaction in the blood vessels, which are usually noted in other conditions we have discussed. Similar changes can also be noted in radiation of the brain tumors and diffuse fibromuscular dysplasias. They are also noted in phacomatoses like neurofibromatosis type 1, and in cases of the tuberous sclerosis. We need to investigate such patients as to rule out any associated underlying blood dyscrasias like sickle cell disease, essential thrombocytopenia, polycythemia rubra vera, aplastic anemia, and Fanconi's anemia, while we have to rule out any history of tuberculous meningitis or bacterial meningitis, and sometime post varicella vasculitis can present similar pictures. Less common causes are Graves' disease, Down syndrome, ulcerative colitis, and use of the oral contraceptives. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuhu.